The Ghana Association of Bankers has made a commitment to support frontline workers in the fight against COVID-19 in the country with a budgetary allocation of 10 million Ghana cedis. The fund, which will be used to purchase personal protective equipment and other medical items, will be distributed to some individual institutions that are directly involved in the fight. To this end, the association has made its first donation of about 3 million Ghana cedis to institutions including the Noguchi Memorial Institute for Medical Research.
The focal point for this was the role of Noguchi and the constraints that Noguchi had. And we all understand the importance of testing. So our first focus was to ensure that we could respond to the needs from Noguchi, and they had to import a number of items which totals the $325,000. We've given them the CD equivalent of that to enable them procure and then to tool up so they can continue to play the role that they are playing. The other one is the resident doctors. And for us, the resident doctors are really in the front line, and they made a very early appeal, which we have responded to. And the community water came through, and again, the problems in the rural areas would just be multiple times what we have in the urban centers. So we thought it was also a very good area to really intervene. I mean, what Dan spoke about in terms of the KAI, because with this disruption, all these people who were making a daily living on the street have nothing to live on, and therefore, when the need came, the association, with a lot of enthusiasm, embraced the feeding of 5,000 KAI for 10 consecutive days, which cost about 300,000, and we are part of a bigger group that is doing that. So we're very happy to do this. We still have some, gunpowder left. We would continue to work with the Minister of Health and other areas. We're just discussing a colleague, Julian, leading a group to try and put up a hospital in the Ga East area, and we will be working with that project group as well to see how we can get ready, not just for this pandemic, but to ensure that going forward. We're just also talking about the number of ICU beds in Ghana, and in order not to frighten too many people, but I don't think we have enough ICU. So let's intensify our prayers, let's intensify prevention so we don't have a lot more ICU cases to deal with in this particular.